Hi, and welcome to another of these talks we're having for International Fathers Mental Health Day. My name's Andy Mayers. As some of you all know, I'm the co-lead or the co-UK lead for these global events. And essentially what we're trying to do here is raise a little bit more awareness about fathers and their experiences, their mental health, bonding with their infants, all that sort of thing, with a view to just getting a little bit more awareness out there and maybe trying to make a difference to improve the way for dads. So today, I've got Dan with me. I'll get Dan to introduce himself in a moment, but I've known Dan for a number of years, mainly through the work we both do at Dorset Mind. So Dan, tell me a little bit about yourself and your role as dad.
So yeah, thanks for having me, Andy. So a little bit about myself. So I'm Dan Willis. I'm professionally I work. So I'm co-founder of a business called Wellgood, where we are a workplace mental health platform. I suppose on topic, I'm a father of two boys, one who is 6 years old, so in year one at school, and the other who is in nursery, so he's 2 years old. And so, yeah, being a working parent and with my wife working as well full time, and balancing two very active children, as you can imagine, it can be quite a challenge at times.
It absolutely can. I mean, and although my role as a father is a long time ago now, I've got two grandsons. Well, I've got seven grandchildren altogether, and three of them are lads, but two of them similar ages. I've got a grandson of 6 and a grandson of 2. Um, but what we're looking at here is just that experience. And tell me a little bit about how becoming a father had an impact on your own mental well-being, mental health.
Definitely. So I suppose, going back 6 years ago, I wasn't actually involved with Dorset Mind at the time. So I'm really fortunate that I am an ambassador for Dorset Mind. And a lot of this has come about due to having my boys. So I wasn't really in touch with my own mental health, or, really that aware of any of my mental health challenges at the time of my firstborn coming along. And it wasn't until he was in my world that everything changed. And it's very it's one of those cliches, isn't it, that when you have your firstborn or when you have your son, your whole life changes. And in actual fact, mine did. I started learning more about myself than I probably had learned in the previous 20 years, being honest. So I suppose, it was that moment where I started learning more empathy. I suppose that was one big factor, and due to that, I was able to then subsequently get some support for my own mental health, which led to an eventual diagnosis of bipolar disorder. And I probably wouldn't have done that if it wasn't for having my first boy.
Yeah, I think we've increasingly find this. I mean, I've been working in perinatal mental health for getting on to 20 years, and only the last 6 or 7 with dads. And one of the things I find increasingly with dads, and really commonly, is it's the first time they've really had. It may be the first experience of a mental health problem, either themselves or what they might see in their partner, but also the first time they've actually had to confront that. And until relatively recently, we didn't have a great deal of support. Now, because of things like this and because of work that's been done, that is beginning to improve, which is great. One of the things we have been seeing as well, and I know this is something you've spoken about, at least to me, is one of the impacts of becoming a new father and that impact on mental health is the way in which you're then able to bond with your infants. How did you find that with your boys?
I suppose with my first boy, you know, that bond was actually quite easy, I found, although you know, as a separate section, you know, the lack of parental leave didn't help with that. But then with my second born, it probably wasn't until he was about 11 months old, 12 months old, that I actually started to bond with him properly. And that was really difficult for me from a mental health perspective. It didn't help that I was working, well, I was commuting away every day, and wasn't able to create those bonds by working locally. But even still, it wasn't probably for nearly a year, until lockdown actually, that we were able to actually start bonding, which was, yeah, it really triggered a lot of sadness, a lot of frustration from my side, especially when it meant, you know, if he falls over, as an example, you know, he would never come to me. He'd never want to come for cuddles, you know, and that aspect, it was really quite defeatist from my side of things, and at times made me feel quite worthless, until we were able to actually start bonding, which was actually during lockdown, which was amazing.
We'll come back to lockdown again in a moment, because I think it is interesting. There's been a quite a balance in terms of the experiences there, but I think in terms of generally bonding, I think it's really important, and it's work that I'm keen to look to support, certainly locally. One of the other groups that I'm linked to is Dorset, and we work with parents navigating their way into parenthood and helping to build those bonds where those bonds might already be a challenge. And we know it can be often quite difficult for some chaps to actually engage with those emotions, and even sort of letting down those barriers, because it means getting down on the floor and doing dark things with children, which some blokes just find so hard to do. But as a grandfather, I absolutely adore.
Right.
And I think it is for often one of the bigger challenges for
Sure.
dads.
Sure.
But,
You know, I've always been a very affectionate father, you know, always very cuddly. I'm not ashamed to kiss my kids, you know, those sorts of things. You know, I'm incredibly affectionate. And you'll probably hear Sebastian, my second born, crying right now because he's just woken up from his nap. But but I'm incredibly affectionate. But the problem was that due to the strain that I had around work, you know, an example, I've never taken parental leave really. You know, which I think was a really big factor to the lack of bonding, especially for my second child, to a point where he was born 8 o'clock in the morning, on his birthday, and you know, I was in a meeting, a work meeting at 2 o'clock in the afternoon. Ashamedly, you know, that's not a great move. I can't imagine how it made my wife feel as well. But you know, absolutely embarrassed and ashamed that, you know, that's what I was doing, and no wonder there was a real challenge around bonding with him in that first place.
I think this is crucial, and it was at a point that I was going to pick up, and you've reminded me to go back to that, this whole thing of parental leave. And it's harder when you're running a smaller business like you are, but I think we need to be looking at right across the board, whether it's a small one-person operation, partnerships, small businesses, through to the larger organizations. We need to revolutionize the way we're looking at parental leave. And for those who are watching this, just go to my resources on my website. You'll see that we're beginning to work with various places to actually look at what we need to do to change this whole thing, because we know that the more fathers are able to spend that crucial time in those early few days, it can make such a difference. But you mentioned lockdown there, and it's an interesting point. We have heard many negative stories, we heard some positive stories, but you alluded to it there. How did you find that COVID changed the way in which you were able to interact with your family?
So being honest, I've worked away, really commuted away for the past sort of 5 years, and lockdown was the first time really that I've slowed down in all that time. And it was really interesting, you know, to have spent the past year at home. It's really forced me to have, you know, a daily connection with my children, which I've always wanted. It's just time has never been, you know, available for me to have that. And initially it was really quite a struggle. You know, it was still very much he wants mummy, you know, in that aspect. But what we managed to do is through through the additional time that I had because of the fact that we were locked down, was that we could have some, you know, daddy son time, you know, some specific time that we could go on adventures, that we could, you know, go and play, because play is so important. And because of that, you know, our bond now is probably stronger than I could have ever wanted, to a point where he's more than happy to come to me rather than mummy now. So I'm more than happy.
I love that. That's really nice. But I mean, and I think this does illustrate, because we have and will be speaking across the day about some of the negative impacts of COVID. We know that through maternity services, pregnancy, the birth itself, various appointments, dads haven't been able to be there. There's been a huge impact, but there's been some positives. And we've heard so many stories like yours. You know, even though working at home, and I'm working from home, it's a different way of living, because you can take a slight break and do something, in your case, interact, which is lovely. One of the things you were mentioning earlier, though, was about, you know, you recognised that there was a problem. You went to get help, you were diagnosed, and you got that support, which is great, because in many cases that hasn't happened. But what support did you actually get in terms of becoming a father and that relationship with mental health?
What support did I get? Well, in relation to being a father, actually none. You know, it was more just support from, you know, the mental health professionals around, you know, who I was seeing, you know, because of my because of the challenges that I was facing at the time. And then, you know, just really guidance and support from friends and family members in that way. I suppose, you know, it's really interesting, you know, seeing how, you know, through my own journey around my own mental health, because I've really had to focus on empathy, you know, to be able to, you know, live more positively with my own mental health. What that's enabled me to do is actually be a better father, I feel, because, you know, I can really identify what those signs are around me, you know, and what my environment actually has because of that.
Yeah, and I think from what I'm picking out from that is an interesting thing that I've seen before as well. You know, you got some support for your mental health like any adult should, and but not necessarily in relation to the father. And I think this is where we need to keep building, because although it's getting better, in many cases, the health professionals who deal with the mental health side don't necessarily put that in context of being a father, because it could be a factor. And also the health professionals themselves, like the midwives, health visitors, GPs, anyone else involved in that time, doesn't necessarily think about dad. And this is what we need to change too. And the more we bring that together, the more we're going to help the entire family. And that's the point, if you like. You've said quite a few things, really, and I think you're a shining example of what, for me, is the modern dad. I think we've got a lot to learn from that. But, you know, we got these resources for International Fathers Mental Health Day, and we're trying to raise awareness and all of that. So there's going to be dads, not to make you worry here, but there's going to be dads from all over the world watching this. Is there any message you'd like to give to dads as they, you know, a new dad who's encountering this for the first time, about what they could do?
I think the biggest lesson that I've ever had is for my own mental health, as an example. I don't do it for me. I don't live more positively for myself, in that way. And it sounds really strange, but I don't look to become a better human just for my benefit. The stuff that I do around mental health and the openness that I talk around it is actually for the benefit of my boys, because it wasn't until I was in my late 20s that my eyes started opening to what mental health was, and at that point it was actually a problem for me, and it hit me like a brick wall. But what I want for my own children is for them not to have that brick wall hit them in their late 20s. I want them to grow up with their eyes actually open to what mental health is, and so that they can learn that resilience, and they can learn what is positive about mental health and what's negative in that way, and ways that we can communicate around it as well, because that's the most important thing. So I think this is why days like this are so important, is that we can share our message around, actually it's not just for you, it's actually for your boys, it's for your girls, it's to be able to help them in their future lives and for their children as well.
And you captured precisely the kind of things we're saying all the time. So thank you for that. And I can hear the little one in the background there, which kind of sums up rather nicely that they should get a look in here. But it is about that. It is about the fathers and the families. We do this. Many people, when I first started doing this, said, "Oh, you're going to try and take the limelight away from the mothers." No, not at all. I'm still doing a lot with the mothers. What we're doing is we're looking at the entire family. We help the father, we'll help the mum, we help the mum, we help the father, we help them both, we help the child. And your little one there sounds just great. So you're doing something
massively. And do you know what? It's not about distracting from mothers at all. It's about, we co-parent in our household. So my wife, she works full time, I work full time. So we live very equal in that way. And unfortunately, society doesn't look at it in that way, and there isn't shared parental leave in the way that it can be equal. Yes, women go through trauma, through pregnancy, and completely understand that. But that bonding aspect that men need to have with their children, 1 week, 2 weeks that you get through, government funded, paternity leave, it's not enough, and the traditional old-fashioned thinking of, well, the men go and earn the money, or the women stay at home. It's not the reality of what it is anymore, and it hasn't been for a very long time. And so until we can get real understanding of what shared parental leave looks like the Nordics do, Scandinavian countries, that we can aspire to be like, then that's when we'll start seeing a real shift in men's behavior around being parents.
You couldn't have said it any better. I certainly couldn't have said it any better. Dan, this has been absolutely brilliant. Thank you. I know a lot of dads are going to get a lot out of this. And so I'm looking forward to sharing on a day. This will be across many platforms on social media. So thank you. And hopefully catch up with you again soon.
Yeah, definitely, Andy. Thanks for having me.
No problem.